If you are eating fruit every day thinking you are doing the right thing for your blood sugar, I need you to stop for a moment and pay attention to what I'm about to tell you, because this might be one of the most important things you hear this year. And I am not saying that to grab your attention. I am saying it because I have watched this exact mistake quietly make things worse for thousands of people. People who were genuinely trying to take care of themselves. You are going to want to stay with me all the way through this because by the end, you will have a completely different understanding of fruit. Not just which ones to avoid, but which one actually helps your body handle sugar better over time. And that information alone could change the way you feel on a daily basis. I want you to think about something right now. Think about the last time you ate fruit. Maybe it was a banana in the morning. Maybe grapes as an afternoon snack. Maybe a glass of orange juice because it felt like the healthy choice. Now, I want you to imagine what was happening inside your body in the 30 to 60 minutes after that. Because for a lot of people, that healthy choice was quietly triggering a blood sugar response they never even noticed. Not until the hunger came back too fast, or the energy dropped, or the craving for something sweet hit them again out of nowhere. That is not a coincidence, and it is not weakness. It is biology. And once you understand how it works, you will stop blaming yourself and start making choices that actually help. My name is Dr. Megan Foster. I have spent years working with patients dealing with insulin resistance, prediabetes, and type 2 diabetes. And one of the most consistent things I see is this. People are confused about fruit. They know soda is bad. They know candy is bad. But fruit is supposed to be healthy, and it can be. But not all fruit behaves the same inside your body. And the difference between the right fruit and the wrong fruit, especially eaten the wrong way, can be enormous when it comes to your blood sugar. This is where mainstream health advice tends to get it wrong. It tells you to eat more fruit. Full stop. No detail, no context, no explanation of how sugar from fruit actually moves through your system. And that missing context is exactly what we are going to fix today. I want you to think back a few years, maybe 5 years, maybe 10. Think about how you felt after eating something sweet, a piece of fruit, a small dessert, something with natural sugar. Back then, you probably handled it fine. You did not crash. You did not feel foggy. You did not feel hungry again 20 minutes later. Your body absorbed it, processed it, and moved on. Now think about today. Maybe the same thing hits differently. Maybe you feel more tired after meals than you used to. Maybe your energy is less stable. Maybe the cravings are more intense, and maybe you have been told that is just aging, that it is normal, that there is nothing much you can do about it. That is not accurate, and I want to be very clear about that right now. That shift you are feeling, that change in how your body responds to sugars is not just aging. It is not your body suddenly breaking down. Something specific changed in how your body handles glucose. And the good news is, once you understand what changed and why, you have real tools to start shifting it back. That is what this video is about. Let me explain the basic idea without any complicated medical terms. Think of your bloodstream like a main highway. Glucose, which is just the word for sugar in your blood, is the traffic on that highway. Now, your body needs glucose. It is fuel. The issue is not glucose itself. The issue is how fast it arrives and how much comes at once. When you eat something that releases sugarly, the traffic enters the highway gradually. Your body handles it smoothly. Insulin, which is the hormone that helps move sugar out of your blood and into your cells, does its job at a normal pace. Everything flows. But when you eat something that releases sugar all at once, it is like dumping 1,000 cars onto that highway in 60 seconds. There is a surge, a spike. Your body has to release a large burst of insulin to deal with it. And your body can handle that once in a while. The problem is when it happens over and over again, multiple times a day. Day after day, week after week, over time, your cells start to get worn out from constantly responding to these surges. They become less sensitive to insulin. They do not respond as quickly. So your body has to produce even more insulin to get the same effect. That is insulin resistance, and it is one of the primary drivers of prediabetes and type 2 diabetes. Here's what makes this tricky with fruit. Some fruits release sugarly, some release it fast. And the difference between them has nothing to do with how sweet they taste. It has to do with fiber content, the type of sugar they contain, and how those compounds interact with your digestive system. That is exactly what we are going to go through today, fruit by fruit, from the ones that create the biggest problems to the one that actually helps your body work better. And this is not just my opinion. I want to be clear about that. Large-scale research studies, including data from institutions like Harvard School of Public Health, have followed tens of thousands of people over multiple years, tracking their fruit consumption and their risk of developing type 2 diabetes. And what those studies found was striking. Certain whole fruits, particularly those high in fiber and polyphenols, which are natural plant compounds, were associated with a significantly lower risk, while other fruits, especially in processed or high-sugar forms, showed the opposite pattern, same category, completely different outcomes depending on which fruit, how much, and how it was eaten. So, let us go through the list. 7 fruits ranked from the ones that cause the most blood sugar stress to the one that is genuinely working in your favor. And I want you to really pay attention here, because several of these are going to surprise you. Before we dive in, I'm curious. Which fruit do you eat most often right now? Drop it in the comments below. I read them, and you are going to have a very interesting reaction when we get to that fruit on the list. Starting at number 7, and this one might feel obvious once I say it, but I promise you millions of people still make this mistake every single day. We are talking about fruit juice. Fruit juice, orange juice, apple juice, grape juice, even the ones that say 100% natural, no added sugar, fresh squeezed, it does not matter. And here is why. When you eat a whole piece of fruit, the fiber in that fruit acts like a barrier. It slows down how quickly the sugar gets absorbed into your bloodstream. The sugar still gets in, but it enters gradually. The traffic flows smoothly. When you drink juice, that fiber is gone. It was left behind in the pulp that got strained out. What you're left with is essentially liquid sugar, and liquid sugar hits your bloodstream extremely fast, almost as fast as soda. Studies have shown that liquid sugar, even from natural sources, causes faster and higher blood glucose spikes compared to eating the same fruit in whole form. And here's the part that makes this even worse. When you eat a whole orange, you feel full after one orange. The fiber and the volume fill you up. When you drink orange juice, you might be drinking the sugar equivalent of 3 or 4 oranges and not feel full at all. You are getting a much larger sugar load delivered faster, with nothing to slow it down. The common mistake I see all the time is people drinking juice first thing in the morning on an empty stomach. That is genuinely one of the worst things you can do for blood sugar stability. Your system has been fasting overnight, it is sensitive, and then you flood it with fast-moving liquid sugar as the very first thing. The spike that follows can set your blood sugar on a roller coaster for the rest of the day, driving cravings, affecting your energy, and making it harder to eat well for the rest of those hours. If you are currently drinking juice and you take away one thing from this video, let it be this: swap the juice for the whole fruit. Just that one change. It sounds too simple, but the biological difference is dramatic. Moving to number 6 on our list. And this one surprises people because bananas have this reputation as the ultimate healthy snack. Athletes eat them, parents give them to kids, they are everywhere, and they are not the enemy. But there is an important detail about bananas that most people do not know. A banana's effect on your blood sugar depends heavily on how ripe it is. An unripe banana, one that is still slightly green, firm, not fully sweet yet, contains a significant amount of what is called resistant starch. Resistant starch is a type of carbohydrate that your body cannot fully digest and absorb as sugar. It passes through more slowly. It acts almost more like fiber. So an underripe banana has a relatively modest effect on blood sugar. But as a banana ripens, as those brown spots develop, as it gets softer and sweeter, that resistant starch converts into simple sugar. The chemistry of the fruit literally changes. A fully ripe, very sweet banana can spike blood sugar considerably faster and higher than the same banana eaten a few days earlier. The common mistake here is eating a very ripe, very sweet banana on its own as a quick snack, especially in the afternoon when a lot of people hit an energy dip and reach for something fast. That ripe banana alone is going straight into your bloodstream quickly, and the sugar rush that follows is often what drives that mid-afternoon crash people blame on other things. If you love bananas and do not want to give them up, and you do not have to choose ones that are less ripe, slightly firmer, slightly less sweet, and never eat a banana by itself. We will talk more about pairing in a moment, but eating any fruit alongside protein or healthy fat significantly slows the sugar absorption. A banana with some almond butter. A banana with a handful of nuts. Already a very different blood sugar story. Number 5. And this one surprises people because these feel light and refreshing and not particularly sweet. We are talking about grapes. Grapes are one of the easiest fruits to overeat. Think about how you eat grapes. You do not sit down with one grape. You sit down with a bowl or a bag and you eat them one after another without really tracking how many you have had. They are small, they are easy, and before you know it, you have eaten a very large portion. The issue with grapes is this combination. They are relatively low in fiber per serving. They are high in natural sugar, and they are extremely easy to eat in large quantities quickly. That combination creates conditions for a meaningful blood sugar spike. Not because one or two grapes is a problem, but because the portion that most people actually eat is far larger than what would be considered moderate. There is a reason that in research looking at glycemic response, meaning how much a food raises blood sugar, grapes show up as more problematic than many people expect. Portion size is everything with grapes. A small handful is very starting to see more clearly. And from here, every better choice you make builds on the one before it. That is how real, lasting health change happens. Not in one dramatic transformation, but in the accumulation of better decisions made consistently by someone who finally understands why they matter. Thank you for staying with me through this. If this was useful, and I hope it was, please share it with someone you care about who might need to hear it. Drop your most common fruit in the comments below. I genuinely want to know, and if you want to go deeper on this topic, the next video is right there for you. Take care of yourself. You have everything you need to do this.